In today's video, we're going to take y'all along on a dental cleaning procedure that we're going to be performing on this patient, Stuart, here. He is already pre-sedated with some sedation medication, so he's pretty sleepy. All of our surgeries, and including our dental cleanings, all get an IV catheter placed, so that's what we're doing here first. An IV catheter allows us to have IV access to administer medications and also give fluids to our patients during their procedure. It also helps maintain their blood pressure, makes just important to have, so we always make sure it's taped nice and securely, and we always flush it to make sure it's good. Now we're getting started here, getting him hooked up to the anesthesia machine.
So we have just gotten our ET tube placed. We know that it's symmetrical because we listened to both sides of the lungs. We're working on securing our ET tube, and we're going to move over to our cuff placement, our cuff next. There's a couple different ways that we can keep our patients warm. We have a bear hugger here. So it's a forced air. We like this for our dentals because we're not worried about sterility. It's a really good method to keep them warm. Sarah's going to go ahead and get him hooked up to our ECG, our pulse ox. And typically when we're doing this, we're talking a lot. We're confirming, okay, we lube the eyes. I don't believe we've done that yet, so I'm going to go ahead and do that. We're going to go ahead and tell our scribe that we've given drugs at what point, and they're going to start noting his vitals. So Sarah's using the ultrasonic cleaner here to get that calculus off. If it's a more advanced case and there's chunks of tartar, we can actually get those off with our tartar forceps, but his was kind of mild. One thing that I think is critical is we're doing this under general anesthesia. You can see the breathing tube that he has in. We can get under the gum line when they're anesthetized. You have some people that will go have their groomer, do a scaling as they're at the groomer. You can't get under the gum line with them awake. Okay, so depending on the severity of our mouth, sometimes we will map ahead of cleaning, or we'll go ahead and clean first and then map. So this is on the 200 quadrant, so the left upper quadrant that we're going to start with. And so I'll talk out my findings here. The incisors are normal. There's no pockets. And then going over to the canine here, we've got a little bit of gingival recession on the canine here. So 204 has some mild gingival recessioning, but no pocketing. It's solid. That's definitely a tooth that we're going to just clean up, but just going to note that gingival recession. 205 is normal, but we did find that 206 is mobile, and we would not have found this on a wake exam, but that tooth is going to have to be addressed today. So little guy is going to have this second premolar extracted, so we're going to block behind it. That's an infraorbital block. This is a mobile tooth already, so I'm just going to elevate this tooth out. We have our full IM3 machine that has high-speed burrs. If we needed to do a surgical extraction, we absolutely would. Typically, this tooth would require sectioning, but in his case, it most likely was already broken and absorbed by the body. This is something that happened a while ago. So in his situation today, we just removed the remaining root, elevated it out, and we're going to suture it up to help with healing.
So what you can't see behind the scenes is there are typically 2, sometimes even 3 assistants in the room with your pet at all times. So one person, their sole job is to monitor your pet under anesthesia. So making sure they stay warm, monitoring their vital signs, their heart rate, their oxygenation, just making sure that they are staying stable during the procedure. The second person is actually recording these findings so that we can input these vital signs into their medical record. So they're monitoring all these numbers. If we have any notes that we need to call out and make, they're recording that, recording any medications given as well. And the third person is a charge nurse and just an extra set of hands, extra eyes, all on the monitoring equipment. So this third person is inputting things into the computer, making sure all the charges are complete and accurate, and then also helping with any positioning and again, a third set of eyes just monitoring your patient at all times.
So we're into recovery now with him. He is still on all of his monitoring. The only thing he is not on is his gas right now. He's oxygenating well on room air. We're almost to the point where we're going to remove his breathing tube.
If you just saw, he did just swallow once. We typically do not remove the ET tube until they have swallowed at least 3 times. That way they have control of their airway. There's 2.
And I'm sorry, y'all, on this one, we're not going to have any funny videos of them talking crazy madness in the back seat.
That was yucky. Oh.
Yeah, cough it up. And this is exactly what we want from our recoveries. Smooth, quiet. He may not know where he is yet, but he's not vocalizing. As a very smooth recovery.
Boy.
We always note extubation time and temperature at time of extubation. Successful dental procedure. We hope you found this video helpful.
Be sure to subscribe for more questionable content from Dr. Andrew and Dr. Jen. Until next time.